Good morning and happy Tuesday, everyone. Hoping everyone had a good new year and wishing you a happy new year ahead. Welcome to 2025. Let's get into it. Today we've got another episode of our Oral Pathology Corner. Today talking about another topic related to implants. We've talked a lot here in the past weeks and months about implants and other replacement options for missing teeth. And one of the things that I mentioned when we were talking implants is that they're not perfect, and that while they can't get cavities, they can get gum and bone loss, periodontal disease, just like our natural teeth, which is why it's still important to brush and floss around implants just like our natural teeth. And so that's today's topic. Fairly simple one, but if we start getting periodontal disease around an implant, that is called peri-implantitis, which is just a fancy way of saying that the bone and gums around the implant are inflamed and starting to resorb. And just like with our natural teeth, obviously the concern with that is if we lose too much bone and gum support, then the implant is going to get loose, and obviously no one wants that. So, a healthy implant should have good bony support around it, pretty much for the full height of the implant, about like this. But with peri-implantitis, we're going to see bone loss like this. And I hope you can appreciate that, with bone loss like that, there's not really anything keeping that implant in. There's no bone in the threads of that implant, and so it's just kind of floating there in space. And like I said, obviously the main cause of peri-implantitis would be poor hygiene around the implant. There can be other causes, though. Just like with our natural teeth, smoking is another risk factor that it's just not good for the blood supply to the bone and gums around our teeth, and so that can weaken the bone around an implant just like our natural teeth. And so diet can also be a factor. Also, if the occlusion, the bite on an implant isn't correct, that force over time, A, can cause the implant to fracture, and B, it can also just, that repeated heavy force on the implant can irritate the bone and cause it to resorb as well. And there can be many other factors as well. Those are just some of the more common ones, but obviously with peri-implantitis, just like regular periodontal disease, the name of the game is prevention. Good hygiene, good brushing and flossing, and especially water flossers are very, very effective getting around the nooks and crannies of an implant. But in the event that someone ends up with peri-implantitis, doesn't mean for sure that the implant is a lost cause. There are different treatment options for that, kind of like when we have periodontal disease around our teeth. That's you're kind of seeing that same pattern, is that there's a lot of similarities between the two. Sometimes if it's just a hygiene related issue, just getting in there and with our special instruments and cleaning thoroughly around the implant, under the gums, to prevent that inflammation, sometimes that will prevent the peri-implantitis from progressing. But in any rate, if we're in a situation where there's peri-implantitis, there's a chance that the implant can be lost, but Again, there are sometimes treatment options if things haven't advanced to a critical point yet. So, anyway, that's basically what you need to know about peri-implantitis. So, I hope this was enlightening, and I hope this is part of a good start to your new year. Thank you for the privilege of your time, and I hope you will join me on next week's Tooth Teacher Tuesday.